Welcome to the Deep Dive. You're joining us for a fascinating exploration into the world of artificial intelligence in healthcare.
That's right.
Specifically, we're looking at something called HealthBench today.
Mm.
Think of this as your shortcut to understanding why this new yardstick for AI could be a real game changer, for the future of medicine.
Yeah, absolutely.
We've sifted through the research, including the main HealthBench study itself, to bring you the really important insights.
And hopefully without the overwhelming tech jargon.
Exactly. Just the stuff you really need to know.
Yeah, you've probably heard about the amazing potential of AI in health. I mean, making it easier for people to get information, supporting healthcare professionals.
Right, even helping you make informed decisions about your own well-being.
But, and this is the big question, how do we really gauge if these advanced AI systems, these LLMs, are reliable enough? Especially for such critical situations.
Okay.
And that's precisely the challenge HealthBench steps in to address.
Okay, so let's break it down then. What is HealthBench exactly? From what we've gathered, it's an open source benchmark. Think of it like a publicly available standard. Anyone can use it to test how well these large language models perform in, well, realistic healthcare scenarios.
And it's built around 5,000 of these scenarios.
Yeah.
Crucially, they're presented as multi-turn conversations.
Not just one-off questions then.
No, exactly. It's that realistic back and forth, much like you'd actually have with a doctor.
And here's where it gets, I think, really interesting. Instead of traditional tests, like multiple choice questions,
Right.
HealthBench evaluates these conversations using conversation-specific rubrics.
Which are essentially detailed sets of criteria, almost like checklists. And they're created by actual doctors.
How many doctors are we talking about?
Get this, 262 of them, from 60 different countries and spanning 26 medical specialties.
Wow, 262. That's a truly global perspective.
It really is.
Think about that. Over 260 doctors, all bringing their real-world experience to define what good AI looks like in healthcare.
Yeah, that level of expert input, that's really key. It shows it's built on actual medical practice, not just abstract metrics.
And the sheer number of unique criteria they developed, what was it?
48,562.
48,562 unique criteria. It just highlights how incredibly nuanced these healthcare interactions are.
Absolutely.
Now, the research points to three key areas where current AI evaluations kind of fall short and where HealthBench aims to make a real difference. What are those critical limitations?
Okay, so the first big one is whether the scores we get from current AI tests actually tell us anything meaningful about, real-world performance.
Right. Do high scores actually mean better healthcare outcomes?
Exactly. Many existing evaluations, they rely on simple question and answer formats, which, let's be honest, don't really capture the open-ended dynamic nature of a real health conversation.
Yeah, it's one thing to pick the right answer on a test, quite another to have a genuinely helpful dialogue about something complex, right?
Precisely.
Okay, what's the second limitation HealthBench tackles?
Trustworthiness. Can we be confident that the scores these AI models get actually align with what doctors think, with physician judgment? A lot of current evaluations haven't really been rigorously checked against expert medical opinion. HealthBench, though, with its doctor-written criteria and that physician-validated grading, it directly addresses this.
That makes perfect sense. You need that assurance, don't you? That a high score means experts would generally agree it's giving sound, safe advice. And the third area?
Saturation. Basically, are the benchmarks we're using still challenging enough?
You mean have they become too easy?
Yeah, exactly. If the tests are too easy, there's not much incentive for developers to push the boundaries and make even better models. HealthBench is designed to be complex enough to keep challenging the state of the art.
Okay, so HealthBench aims for scores that mean something in the real world, that doctors trust, and that keep pushing AI development forward.
That's the goal.
That's a great overview. Let's now explore how this ambitious project actually came together. Our sources detail the genesis, starting with AI's growing role in healthcare. Why was a new benchmark needed now?
Well, we're just seeing AI play an ever-increasing role, aren't we? How people access health info, how doctors provide care, how we manage our own health.
Yeah.
And these large language models, with their ability to process just vast amounts of medical data and tailor responses, they hold incredible promise here.
It's exciting, the potential to improve access and quality of care, especially maybe in underserved areas.
Definitely.
But as we've said, ensuring these AI systems are safe and effective, That's absolutely critical when you're dealing with health.
Couldn't agree more. And that's why this huge collaboration with those 262 physicians is just so vital.
It wasn't just a small group.
No, it was truly global, diverse. Doctors from 60 countries, 26 specialties. That wide range of perspectives really strengthens its credibility and relevance.
And it took 11 months of development.
Yep, 11 months. Shows a real commitment to getting it right.
And the selection process for the doctor sounds really thorough, too. Over 1,000 initially expressed interest.
That's right, over 1,021. And only about a quarter were ultimately chosen.
So what were they looking for in those physicians?
Well, strong clinical experience, obviously, but also a clear sense of purpose in contributing, and importantly, the ability to think about medical scenarios beyond just their own local context.
Ah, interesting.
They even had potential participants do some initial tasks, like drafting example rubric criteria, just to assess the quality of their input and understanding.
Okay, so we have this globally sourced, expert-vetted benchmark. Now let's really dive into what makes it different. It's this rubric approach, isn't it? How does that actually work?
Precisely. So unlike evaluations that might just look for one right answer, HealthBench looks at the whole conversation between the user and the AI.
The whole back and forth.
Exactly. And then it evaluates the AI's responses against a detailed set of criteria, the rubrics that are specifically designed for that particular conversation. It's not one size fits all.
Right, a very tailored evaluation. Can you maybe paint a clearer picture? What does one evaluation example look like?
Okay, imagine someone describes, say, certain symptoms to an AI model. The AI responds with some advice. The evaluation example includes that entire exchange. Then alongside it, you have the rubric, that set of specific criteria written by a physician outlining what a good, safe, helpful response should look like in that exact situation.
And what sort of things do these rubric criteria focus on?
They're designed to be really self-contained and objective. They focus on exactly what a good response should do or avoid in that specific context.
So like specific facts?
Yeah, specific facts, maybe mentioning certain medications at the right dosage, ensuring the language is clear and easy to understand.
Or maybe avoiding common myths.
Not exactly, or avoiding common misconceptions about a health issue. It's quite detailed.
And there's a scoring system involved too.
Yes, each criterion in the rubric has a point value from -10 up to +10.
-10. So you can get penalized.
Oh, absolutely. Those negative points are really important. They're for things a response definitely should not do, highlighting potentially harmful advice or significant errors.
Okay, so how is the actual scoring done then? Do doctors review every single AI response? That sounds like a massive job.
Not directly, no. That would be incredibly time-consuming. HealthBench uses a model-based grader.
An AI grading another AI.
Essentially, yes. But crucially, this AI grader has been rigorously validated against the judgments of those participating physicians.
Okay.
So this AI grader goes through each criterion in the rubric for a given AI response and decides, does the response meet this specific criterion?
And if it does?
It gets the full points for that criterion, if not 0 points.
It's like checking against a doctor-defined checklist, but using AI to do the checking.
That's a good way to put it. And the overall score for that conversation is then calculated. You add up all the points for criteria that were met and divide by the total possible positive points for that conversation.
And scores can be negative, you said.
They can, yes, if a response triggers enough of those negative criteria, indicating a really problematic interaction.
Right. And the final HealthBench score for an AI model overall, how's that worked out?
That's basically the average of all the scores the model gets across all the conversations in the benchmark. But the final score is also clipped, adjusted to fall between 0 and 1, just for easier interpretation.
Okay, got it. That gives us a solid grasp of the rubric approach. Now, the paper mentions themes and axes within HealthBench. What do those represent? Different ways of slicing the evaluation.
Exactly. They're frameworks to break down and analyze model performance in a more targeted way. The 7 themes represent different real-world scenarios or contexts in healthcare.
Like different departments in a hospital? Is that a fair analogy?
Yeah, that's helpful, like the emergency room or a GP's office, different types of interactions.
Okay, so what are some examples of these themes?
Well, there's emergency referrals, pretty crucial. How well does the AI spot a potentially life-threatening situation and advise getting help immediately?
Right.
Then context seeking. Does the model realize when it's missing key info and actually ask for clarification?
That seems important too.
Very. And global health. This looks at the AI's ability to adapt its responses for different healthcare settings, maybe different resource levels around the world.
Those all sound incredibly relevant. What other themes are there?
There's also health beta tasks, which
Mhm.
is about accuracy with structured medical info, expertise-tailored communication.
Ah, so adjusting language for a doctor versus a patient.
Precisely. Then, responding under uncertainty, does the AI admit when it doesn't know something for sure?
Good one.
And finally, response depth, giving the right amount of detail. Not too much, not too little.
Okay, so those 7 themes cover a really wide range of interactions. What about the axes? How do they fit in?
The 5 axes are more about the core behaviors that each individual rubric criterion is measuring. Think of them as the fundamental skills needed in any situation.
Like accuracy, communication.
Exactly. The skills underpinning good healthcare responses.
So the themes are the scenarios, and the axes are the how well the skills being tested.
That's a neat summary, yeah.
So what are these 5 key axes?
First, accuracy. Is the info factually correct? How does it handle uncertainty?
Okay.
Second, completeness. Does the response include all necessary safe and helpful information?
Makes sense.
Third, communication quality. Clarity, conciseness, appropriate language. Fourth, context awareness. Does it pick up on cues? Does it ask for more info when needed?
Right.
And the last one is instruction following. Does it stick to the user's request, but crucially, while always prioritizing safety and ethics?
Okay. So across these 7 themes and 5 axes, we get to that huge number, 48,562 unique criteria. It really paints a detailed picture.
It does.
So let's talk findings. What happened when various LLMs were actually evaluated using HealthBench? What did it tell us?
Yeah, the research showed some really fascinating trends. Overall performance has improved significantly over the last couple of years.
How significant?
Well, they saw a steady initial climb, but then a much more rapid acceleration recently. To give you an idea, GPT 3.5 Turbo scored around 16%,
Okay.
while one of the latest models, called O3 in the paper, hit 60%.
Wow, 16% to 60%. That's a massive jump in a pretty short time.
Really is.
And it's not just the biggest, most expensive models showing progress, is it? I remember reading something surprising about smaller models.
Absolutely. And this is potentially one of the most impactful findings. GPT 4.1 Nano, a smaller, more efficient model, actually outperformed the larger GPT-4o on some aspects.
Really?
Yes, and it's substantially cheaper to run something like 25 times less expensive.
25 times?
Yeah, this is critical because it suggests highly capable AI for healthcare might become much more accessible, much faster than maybe we thought.
That could really help bridge gaps in care, allow wider adoption.
Exactly. It's fantastic news for broader access and lower costs.
The research also mentions different versions, consensus and hard. What are those?
Right. So HealthBench consensus focuses on 34 particularly important dimensions where the doctors showed very high agreement. It's like a core set of criteria with strong expert backing.
Okay, high confidence areas.
HealthBench hard, on the other hand, is a set of 1,000 really tough examples. Even the best models struggle here. The top score is only around 32%.
32%. Ouch.
Yeah, it really highlights where significant future work is still needed. It points towards the next frontier of challenges.
Got it. What about performance across those different themes? Emergency referrals, global health, etc. Did models do better in some areas than others?
Yes, definitely. Models generally scored higher in themes like emergency referrals and expertise-tailored communication.
That's encouraging for safety and usability.
It is. But areas like context-seeking, health data tasks, and global health seem tougher for the models.
So still room for improvement in understanding when more info is needed, handling data accurately, and adapting to diverse global contexts.
Precisely. Lots of room there.
And looking at the 5 behavioral axes, accuracy, completeness, communication, context, instruction following. Any patterns there?
Generally, completeness, giving all the needed info and context awareness of understanding the conversation's nuances, were areas where scores tended to be lower. Although it's worth noting the O3 model showed a big improvement in completeness compared to earlier ones, so progress is happening.
And this detailed breakdown helps developers pinpoint where to focus, right?
Exactly. It's incredibly valuable for guiding improvements.
The paper also talks about the performance cost frontier. What does that show us?
It basically maps out the relationship between how well a model performs on HealthBench and how much it costs computationally to run it, the inference cost.
Okay.
And the analysis shows a really positive trend. Newer models aren't just performing better, they're also becoming more cost efficient.
So better bang for your buck, essentially.
You could say that, yeah. The models from around April 2025, like O3 and GPT 4.1 Nano, they really define a new, more favorable frontier. Better capabilities, lower cost.
Which is vital for actually getting these tools used in the real world, especially where budgets are tight.
Absolutely crucial.
Now, reliability is obviously paramount in healthcare. How does HealthBench measure that?
They used a metric called worst at K. It looks at the lowest score a model might get if you asked it the same thing multiple times.
Trying to understand the worst case scenario.
Exactly. How consistent is it? How often might it give a poor or even unsafe response? The findings showed recent models are getting better here, more reliable.
What?
But there's still progress needed across the board, even for the top models. Their worst-case performance isn't perfect yet.
So even good models can have bad moments. We need to be aware of that.
Definitely.
What about the difficulty of the questions in HealthBench? Are they mostly easy, mostly hard?
The score distribution suggests most problems are moderately difficult.
So not too easy, not impossibly hard.
Right. There aren't many questions that are trivial for all models, which means there's room to differentiate performance and track progress. But also, not so many impossible ones that the benchmark becomes unusable. It seems well balanced.
Okay. Now, a potential issue with evaluating language models is length bias. The idea that longer answers might just get higher scores, regardless of quality. Did they look at that?
Yes, they specifically analyzed the correlation between response length and the HealthBench score.
Yeah.
For most models, the correlation was relatively weak.
Meaning longer answers didn't automatically mean better scores?
Generally, no. It suggests the improvements aren't just because models are getting wordier. They even double-checked by comparing performance on responses of similar lengths, and the improvements held up.
That's good. It suggests the benchmark is measuring quality, not just quantity.
Seems that way, yes.
What about the error rates on HealthBench consensus, those key criteria doctors agreed on?
They've seen a significant drop in errors there with the newer models. Particularly encouraging were improvements related to emergency situations.
That's great news.
It is. But the analysis also highlighted areas where errors are still more common, like in that context-seeking theme models still struggle to ask for needed information effectively.
Pinpointing areas for more work.
Exactly.
And finally, on findings, the results for HealthBench hard. The really tough questions.
Yeah, those results really reinforce that even the most advanced AI still faces substantial hurdles with the most complex, nuanced healthcare conversations.
That 32% top score really says it all.
It does. It clearly shows there's still a long but exciting journey ahead to develop AI that can truly handle the full spectrum of medical interactions safely and effectively.
So HealthBench gives this incredibly detailed snapshot.
Yeah.
Now, the paper also had a fascinating part about the human touch. They got actual physicians to try writing responses for HealthBench scenarios.
Yes, this was a really insightful experiment. They asked physicians to write ideal responses under 3 conditions.
Okay, what were they?
First, with no AI help at all. Second, with access to responses from older AI models from September 2024.
And
Third, with access to responses from the more recent advanced AI models from April 2025.
And what happened? Could the doctors consistently beat the AI?
Well, interestingly, the physicians could somewhat improve on the responses from the older September 2024 AI models,
Especially in which areas?
particularly in things like completeness and accuracy. They could add value there.
But what about the newer AI?
That's the key thing. When they worked with the responses from the more advanced April 2025 models, they generally couldn't make similar improvements.
Wow. So the AI had caught up significantly in just a few months.
It really underscores the rapid pace of evolution. In some aspects, these systems are approaching, maybe even matching, human-level performance in these specific tasks.
That's quite something. What about the doctors working without any AI help? How did they do compared to the AI?
On average, their performance was relatively weaker compared to the best AI models. But the researchers add an important caveat. Writing responses in this specific chatbot format isn't really typical for doctors.
Right. It's not their usual workflow.
Exactly. And they also noted the unassisted physician responses tended to be shorter than the AI ones.
Makes sense. It's just a different communication style. Now, a crucial point. HealthBench uses an AI to grade other AIs. How do we know that grading process itself is trustworthy?
Absolutely fundamental question. They addressed this through meta-evaluation. They focused on that HealthBench consensus subset.
Where the doctors had high agreement?
Right. They had multiple physicians, independently evaluate whether specific criteria were met for various AI responses. Then they compared the AI grader's assessments to the physician's judgments.
And how well did the AI grader match the human experts?
They used a statistic called the macro F1 score to measure agreement. The results were very encouraging.
How so?
They found that the AI grader, GPT 4.1 primarily, often exceeded the average level of agreement among the human physicians themselves.
Better than the average doctor's consistency.
In terms of applying the rubric consistently, yes. And for most themes, it performed in the upper half of the physician range.
So that strongly suggests the model-based grading is reliable. It aligns well with expert judgment.
It does seem that way. They also found low variability in the overall HealthBench scores across multiple runs, indicating good consistency.
That's very reassuring. It sounds like they took real steps to validate their methods. Okay, so looking ahead, what are the broader implications here? Why is HealthBench such a significant contribution?
Well, it really represents a major step forward in how we evaluate AI in healthcare. More rigorous, more dependable methods.
Right.
It provides this comprehensive, nuanced benchmark that can genuinely guide the development of safer, more effective, more trustworthy AI tools for medicine.
And it highlights where improvements are still needed.
Exactly. It offers valuable insights into where current models still fall short for real-world healthcare demands.
And the fact that it's open source, publicly available, that's important too, isn't it?
Hugely important, making the benchmark, the data, the evaluation tools open. It fosters transparency, collaboration.
It'll have the whole community to build on it.
Precisely. And they acknowledge, that physician judgment evolves, AI applications evolve.
Yeah.
So there's an ongoing need for evaluation, for real-world studies, measuring actual patient outcomes.
So HealthBench isn't the final word, but maybe a crucial foundation.
I think that's the right way to see it. They position it as a meaningful, trustworthy, and still challenging contribution to the ongoing efforts in this critical area.
Well, this has been a really insightful deep dive into HealthBench. It's genuinely remarkable to see this level of rigor being applied to evaluating AI in healthcare.
Agreed. It's clear HealthBench offers a much more granular, more realistic way to assess progress compared to what we had before.
Yeah.
And the rapid advancements we're seeing, especially those capable, cost-effective, smaller models, that's really encouraging for the future.
So the key takeaway for you, our listener, HealthBench marks a significant leap forward. It gives us a robust, detailed way to measure progress in AI for healthcare and pinpoint where we need to improve.
Exactly. And the findings really underscore how fast this field is moving, offering potential for truly transformative impacts on health.
It really makes you think, though. As AI gets more integrated into healthcare, how will benchmarks like HealthBench need to keep evolving? How do we ensure they truly reflect real-world impact and patient well-being?
That's the ongoing challenge, isn't it? It raises so many important questions about assessment and responsible development.
It certainly does. And for those of you interested in digging even deeper, the data, the methods, the full findings,
We encourage you to check out the GitHub repository mentioned in the source material. It's all there.
Thanks for joining us on this deep dive into HealthBench. Lots to think about. We look forward to bringing you more explorations into fascinating areas of knowledge soon.